Okay, everyone, welcome to the City of Revere Board of Health public meeting for June. Please rise for the Pledge of Allegiance. So hello, everyone. So my name is Dr. Drew Bunker. I am the chairperson for the Revere Board of Health, and with me tonight is Kathleen Savage, also to my left, who's a board member. And invited municipal staff, we have Lauren Buck, who's Director of Public Health, Michael Wells, who's Health Agent, Director of Inspectional Services, Paula Supelvita, who's the Board of Health Clerk, and also in attendance we have Nada Abu Hadiba, Community Outreach Liaison, and Yvonne Vu, who's a data analyst. Also in attendance, we have Director of Six City Tobacco Initiative, Bonnie Carroll. First topic we're going to do is we're going to approve the minutes from the May 23rd, 2024 meeting. So I'm going to ask Kathleen if she approves those minutes.
Yes, I approve the minutes.
I do as well. Thank you. Next, part of the meeting is we're going to discuss the smoking violation. So we had a second offense smoking violation at 65 Shirley Avenue. So I'll have Bonnie come up and speak, if you don't mind.
Hi. Okay, this is the second violation for Shirley Ave Variety. The first one was on Sunday, March 27th, 2022 at 9:10 a.m. when a clerk sold Marlboro Red cigarettes to an underage youth. And the second violation was this Sunday, June 9th at 10:50 a.m. when the clerk sold a tin of Zyn nicotine pouches to a youth under the age of 21. And so I recommend, or the board would take under consideration that this is a second offense, it's a $2,000 fine and a 7-day suspension.
Yes, is anyone here from the variety store or this business? Okay. You feel free to say anything if you would like to. It's okay. We understand.
Yeah. My name is MD Hussain, 65 Shalab, Revere. So I know if we get a violation, it's very hard to, we don't want like sell to minor intentionally, but by mistake. So I don't know, give me some advice. We don't want like sell cigarette or tobacco, very hard. Even me, when I work, is unmindful when I can sell unmindful. Is no guarantee. I don't know how to protect this. So intentionally, we don't want sell any product or cigarette. We like to sell like food item. We don't want like to sell like cigarette, But it's happen. Is violation is violation. I can pay, no problem. But it's too much for us. 2,000, 5,000 is too much. I know.
I'm going to ask you a question. Are you checking everyone's IDs every single time?
When I see sometimes most of the people are like 27, 30, 40, look like this. Sometimes come in like, we check ID, younger. But, it's very hard.
Because you asked for a suggestion, that's the answer. You have to check everyone's ID, no matter how old they look, no matter how young they look.
Yes.
That's how you avoid this in the future. This is the second time.
Yeah, I know, second time. I know. It's very hard to
we had
control.
You're not alone. There's been other businesses who've struggled with this. So,
yes,
but I think the best measure is just having a policy, having a sign up when people check out saying that we have to check your ID.
Yeah.
You know, if per the Revere Board of Health or whatever you want to say, so that people see it per state law, and so that, you know, there's no questions and say, hey, I don't like checking your ID, but
No.
they're going to,
Even my computer has, every time you scan cigarette product, they're going to ask
Yes.
ID.
yeah,
Every time, every
Yeah.
single times.
yep. So just, you know, and I know,
Every single times. Yeah, every single cigarette and tobacco item. Every time we can scan show check ID. Every time.
and yeah, and
That's-
so education to employees, because I know one of the
Yes.
things that came up in past was new employees not
Yes,
knowing the
yes,
policy.
He is new, right?
So, yeah,
you're
so
right.
in some circumstances, it was someone who had just been hired, they didn't know, so yeah,
Yeah.
just education.
Yeah, it's very hard, I know.
Yeah, understand.
It's what can I do?
Yeah, no, thank you, and just keep trying. Oh, sorry, Michael.
Okay, thank you.
MD, you're an owner of multiple convenience stores in our city and have multiple tobacco licenses in your name, which is a privilege these days because we don't hand out any tobacco licenses anymore as a Board of Health. So what's out there is out there, and as businesses close, those licenses dissolve unless the business is purchased. So with that being said, you know, you're in a unique situation where you own two, I forget how many businesses you own, but at least 3 or 4 businesses that you own in the city, convenience stores. So it starts with training your staff, number one, right, as Lauren said, and checking every ID. You say it's hard, but it's harder to get a $2,000 fine and a 7-day suspension, okay? That's harder than anything.
Right.
So it's, you know, to get some operating procedures in place. I know you're not in your stores as much as, you know, you're not there a lot in every store. So it's important, it's important for you to be there to see what's going on, and, you know, take responsibility as an owner of 3 or 4 tobacco licenses in our city. Bonnie?
The Mass Tobacco Cessation Program that funds people like me doing this work offers free training to owners of businesses to train their employees. It's online, it's very easy, and you would have gotten a notice of that at one point because we sent them out to every store owner. So you can avail yourself of that and train them to make sure they know what they're doing.
Okay, so we'll just have to vote here to uphold the suspension, the fine. Kathleen, do you mind?
Yes.
Yep.
I agree to.
Agree, okay, I agree as well to uphold that suspension and fine based on the laws and bylaws that we've created here in the city of Revere. Oh,
I just need to say on record, we have not received your payment of the violation. We need to get that as soon as possible, and Mike will talk about when you're going to be serving your suspension.
Right, so suspension will be starting Monday, July 8th, and will carry through Sunday, July 14th, and you can start selling again on Monday, the 15th. We will come out with hand-deliver signage to you. All product must be removed from the counters, display racks, and put in the back room until the following week. We will deliver the signage that is to be posted in 3 conspicuous places. Okay.
great, thank you. Thank you. All right, next topic we're going to discuss is the Public Health Communicable Monthly Report with Lauren.
Thanks, Dr. Bunker. So our communicable disease numbers are looking good over the last month. Our influenza and COVID numbers are significantly decreased as we would expect in the summer months. And I finally just want to give some updates about some seasonal things that I thought were interesting and important for the residents to remember. So some summer heat reminders: heat-related deaths and illnesses are preventable. Despite this fact, approximately 1,220 people in the United States are killed by extreme heat every year. So some quick reminders for the Revere community. Many medications, including over-the-counter medications, can impair heat tolerance and the body's ability to regulate its temperature, which can predispose people to heat illness during hot days. So we want to make sure you pay attention to warning labels on your medications or visit the CDC's heat and medication page to learn more. Secondly, there are certain populations at greater risk for heat sensitivity. These populations include adults over 65, infants, children, people with chronic medical conditions, athletes who exercise in the heat, outdoor workers, and pregnant women. For these populations, it's especially important to take extra precautions. And then finally, a quick reminder about leaving pets and infants in cars during hot days. You should never leave anyone or any pets in a car. Even in cool temperatures, cars can heat up to a dangerous temperature very quickly. Leaving a window open is not enough. Temperatures inside the car can rise almost 20 degrees Fahrenheit within the first 10 minutes. And this is even with a window cracked. So just some reminders about the summer. We're in summer months already, so just a reminder about the heat preparedness that we would like you to all take. Another quick plug is that the Public Health Department is running a summer heat program every Monday through Thursday on the American Legion lawn, which is right next door, from 12 to 3. We are partnering with the Summer Eats program, so if you need free lunch if your kids need a free lunch during the week, you can come out to the American Legion. We'll also have misters, water, sunscreen, so it can be a good cooling station for you if you need it. Secondly, I wanted to remind everyone about the Revere Beach water quality. So a reminder to Revere residents that Revere beaches have water samples taken every Tuesday during the summer months. If you are interested in what the water sampling test results are, you can visit the interactive dashboard by searching Massachusetts Beach water quality in Google. This is where you will find the most updated information. However, the City of Revere's webpage will also post a red banner alert on the main page whenever there is a beach closure. So you can look to our website as well, but if you want real-time information, I would recommend going to the Massachusetts State website, which is the Massachusetts Beach Water Quality Dashboard. Finally, as reported by the Massachusetts Department of Public Health on June 12, 2024, opioid-related overdose deaths in Massachusetts decreased by 10% in 2023. This is the largest single-year decline since 2009-2010. Preliminary data from the first 3 months of 2024 indicate a continued decline in opioid-related overdose deaths in Massachusetts as well. The decline in opioid-related overdose deaths last year was significant among white non-Hispanic men. However, Black non-Hispanic residents continue to be disproportionately impacted by fatal opioid overdoses. Among Black non-Hispanic men, the rate of opioid-related overdose deaths increased from 80 per 100,000 in 2022 to 84.6 per 100,000 in 2023. American Indian non-Hispanics, along with Black non-Hispanic men and women, had the highest opioid-related overdose death rates last year among all ethnic and racial groups. The decline in opioid-related overdose deaths in Massachusetts occurred despite a drug supply that continues to be heavily contaminated with fentanyl. I also want to point out that Revere-specific data shows that we are consistent with Massachusetts in that in 2023, our opioid-related overdose deaths decreased by 10%. This is also just another opportunity for us to talk about the city's new initiative, which is their I believe we're up to 7 now, Narcan boxes throughout the city. You can visit the website, revere.org, and look at the locations where they are. They're in strategic locations associated with a significant amount of overdoses or syringe pickups that we get calls for. So just a good plug to know that Narcan is the way to reduce an overdose related to opioids, and it can prevent death. And we have strategic, free, low access, low barrier Narcan all throughout the city, and we want to make sure people know and use it. That's it. Thank you.
Thank you, Lauren. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspection numbers for municipal inspections for the month of June are for the Interior Housing Division. We performed 45 certificate of fitnesses, 39 re-inspections on certificate of fitness, 9 interior complaints, 2 interior complaint re-inspections, 2 pool and spa inspections, and 7 pool spa re-inspections. On the Food Inspection Division, we performed 42 routine inspections, 10 re-inspections, 4 complaint inspections, 3 pre-opening inspections. On the Exterior Sanitation Division, we issued 80 violations for the accumulation of litter, trash, and debris on the property. one violation or warning for one violation for carts out at improper times, 64 violations for improper bulky item violations, 304 improper placement of garbage and trash violations, 3 warnings issued for improper signage on public property, 1 violation for rodents, and 161 violations for unclean, unsanitary land. As I touched upon last meeting, unclean, unsanitary land, which includes overgrowth and vegetation, we've seen a big uptick in violations for that particular violation. So we, ensuring that your grass is maintained and cut. We don't want to attract any rodents through tall vegetation. Also, I'll touch upon the violations for improper signage on public property. Anybody having a yard sale is required to have a yard sale permit through the municipal inspections. They are free. You can apply for them on revere.org. However, advertising of yard sales is prohibited on public property, including stop signs, telephone poles, or anything like that. So you can put an A-frame signage out. You can put a sign on your car. But you cannot post on public property. That is a violation of city ordinances, and you will get a warning in the mail. Other than that, that concludes our monthly report.
Great, thank you, Michael. Next is going to be the rodent control program presentation. We have Nada Abu Hadiba and Yvonne Vu.
Hello, I'm Nada. I'll be presenting about the rodent control program with my coworker Yvonne. So the city has hired professional exterminators to respond to complaints of rodents. They've hired 2 companies that are each assigned to one part of Revere. Property owners who contact 311 and have a signed waiver will have their property inspected within 14 days. So it must be property owners. If tenants are having issues, they would have to reach out to the property owner in order to sign the waiver. So far, as of June 1st, we've had 327 waivers signed for 2024. A little bit more about the waiver. It is signed once a year, so it does expire at the end of the calendar year, not the fiscal year, so it has to be re-signed every January. It can be signed either online on the revere.org website, at the 311 office, or sent in by mail. And it is translated in all 4 major languages. It does grant the exterminator access to the exterior of the property. It allows them to inspect, treat burrows, and place bait stations. And it allows for a maximum of 6 visits per property annually as requested, meaning that a resident has up to 6 times to call 311 again and say that rodent activity is going up again and they need another visit. A little bit about rodent prevention and the outreach that we've been doing. You can find this again on the revere.org website, also in the liaison office and the 311 office. And it's kind of educating residents on how to prevent rodents from starting to have rodent activity in their property. Also, to look for evidence before, what to look for when signing the waiver. And then a little bit about what the exterminator does at each property. If they find burrows, they will treat them using state-approved products in order to exterminate those rodents. They'll fill up the holes, leave a bait box with rodent bait, and then return whenever requested by the resident. And then every visit, they'll leave a door hanger, letting the resident know of exactly what kind of work they did in their property. So now I'll give it to Yvonne for the data.
Good afternoon, everyone. I'm Yvonne. So far in 2024, and also up to May 13th, 2024, we've had 64 rodent-related calls, and half of them a little bit more than half of them were calls requesting for an exterminator to visit their property. And the rest of the requests were included comments containing the word rat or rodent. And typically, these requests are sent to ISD or routed to DPW for, say, a property inspection that is regarding a rodent or a rat infestation, or oftentimes there are also DPW requests asking to pick up a dead animal in public spaces. And so I will go to the next slide. So this chart only contains up to the end of 2023. However, so far, up through April of 2024, we've had 784 exterminator visits. And that's the largest number of visits we had since the end of 2022. And we saw that this number of exterminator visits have been a little bit more consistent with 2021 and 2022 exterminator visits. And since January 2024, 277 waivers have been signed. And then for the next topic, I wanted to show you the types of reports for rodents. In general, the trend shows that when there are more calls related to rodents, so there would be more exterminator visits. With the exception of 2023, we had more calls than exterminator visits because we were promoting the rodent program through our community liaisons, and so more people were calling in to either fill out a waiver or to get more information on the rodent program. And the most common request types, DPW sanitation related with the dead animals, ISD health inspections, mostly regarding overgrowth and unsanitary conditions. And then we also have ISD-related requests with private properties or unsanitary or improper trash disposal. And that concludes the data reports for the rodent program. Are there any questions for us?
I do have a question. Okay, with the rodents, I mean, I see the pictures that you showed of the burrows. I've also seemed to be having loads of rabbits in my yard, which seem to be burrowing also. It's just...
Can you please say that again? I couldn't hear you.
In my yard, I've tended to have like several burrows that have rabbits in them. How would I distinguish? I mean, yes, in a few days I see the little baby rabbits running around. Yeah.
So I've gone on a couple trips with the exterminators. So you can sign the waiver either way, if you know whether or not it is from rodents, and then the exterminators will let you know if it is a rodent.
The question is, when you do the treatment, what about dogs? Okay, so I have a dog that's in my yard. Will he have to be staying outside the yard for a while?
Yeah.
Or
So
what is the...
for the burrows,
process.
because they do put a treatment inside the burrow,
Okay.
It is recommended that the dogs do not be in the yard during that time so that they don't dig up the burrows
Right.
again. For the bait boxes, those are fine because they're very small and it's hard for the dog to get into.
Okay. I was concerned about the bait boxes, especially,
Yeah.
too, if there'd be something that...
Any other questions?
Thank you guys so much.
Thank you.
That's great. That will conclude this month's Board of Health meeting. Thank you.